has started the administration of the booster shots at 400 sites across the country yesterday after a 2-day delay. The booster shot is being administered to healthcare workers who received their initial jab during the first phase of the Sisonke study between February and May this year. Now let's get some more information on the issue of booster shots, and we're now joined via Zoom by Dr Linda-Gail Bekker, lead researcher for the Sisonke J&J vaccine program. A very good afternoon to you, Dr. Gail. Always a pleasure to see you.
Thank you so much for having us again.
Dr. Gail, let's talk about how you overcame some of the glitches that you earlier experienced. I understand there were 2 days where there had been some issues when you started rolling out the booster shots. And is everything sort of running smoothly at this point?
Yeah, I think we're going to scale very nicely. All 9 provinces have commenced vaccination. Limpopo will be really going full blast from next week, but they have started. And pleased to say every single province is on its way. And we definitely have a bigger operation than we did have for Sisonke 1. So we're hoping, there won't be queues and people can get their jab as quickly as possible, get back to work or back to their lives. And we can do this before any onset of a potential 4th wave.
Doctor, talk to us about, when one needs this booster shot and perhaps if there are any sort of side effects. But on the back of my question, with regards to booster shots, I mean, a lot of people had kind of said, look, I'm keen to have, the first vaccine, first 2 vaccines if I'm taking Pfizer, and the first one if I'm taking Johnson & Johnson, but, kind of worried about this issue of boosters and whether or not one will have to constantly be going for booster shots. So on the back of that question, my initial question, I also want to know whether this is a voluntarily taken or if you've made this mandatory. I mean, what's happening exactly, especially when it comes to rollout at these hospitals?
Yeah, so at this moment, let me tackle that one first. It's important. It's entirely voluntary. Yeah. So people who were participants in Sisonke 1 can make the choice. They can choose to just continue with their primary dose, or they can add this booster. And the idea is that we literally top up their protection. It doesn't mean their protection has disappeared completely. We don't believe that. But if you like, it's sort of topping things up just before potentially the holiday season or a 4th wave, which we don't yet know if it's going to come. But as we all know, those infections have been grumbling on in a number of provinces. The issue around boosters, and I think, we all agree that the story unfolds with us, right? So we had hoped that this would be a very durable response. And by and large, the impact on severe disease and death continues. We have not seen a reduction in severe disease and death protection. What we have seen in the countries to the north of us is, who obviously vaccinated a longer time ago, that we are seeing a reduction in antibody levels, and that there does seem to be an increase in breakthrough infection over time. And I think that has been sufficiently concerning that, as you know, in countries like North America, in Europe, they have moved to boosting healthcare workers, older people, and people with immune deficiencies for whatever reason. Many vaccines don't work as effectively or as long in people who are older. And it's just a function of the fact that our immune systems start to get old as well. And, for that reason, a number of vaccines need to be boosted. Everybody will know that every now and then you need to get a tetanus top up. Your yellow fever vaccine needs to be boosted every now and then. So it varies from vaccine to vaccine. Obviously, we're hoping that after this top up, we may have really good durability, but we're going to have to keep an eye on that over time.
All right, Dr. Linda-Gail Bekker, thanks very much as always for giving us the time and being with us here on SABC News.